Now, leader of Ghana's COVID-19 test team, Dr. Samuel Kaba, has issued a word of caution to Ghanaians and COVID-19 recovered patients that they should not be complacent because there could be reactivation of the virus among patients who have been declared recovered. Now, the health expert has also reiterated concerns of the possibility of getting reinfected even after testing negative for the virus. Dr. Kaba also announced a strategy to trace, capture, and retreat recovered patients who may suffer reactivation or test positive once again when he spoke with my colleague Latif Idris. Listen.
Let's say if we have 50 cases today positive, our figure will jump by 50. But our recoveries will still be down because until the 18 days time I just spoken of, you will not get any recovery.
So we can have cases recorded every single day, 50-50 without recovery, yes, until day 18, then we get recoveries from
exactly.
Okay. So it's good we are having a lot more recoveries, but we've seen cases in South Korea. You mentioned South Korea, and I'm going there to use it as an example. They also recorded huge recoveries. Then days after, there was the issue of reinfection. Do we have a strategy in place in Ghana to ensure that if, and that's not something we are hoping for, if these recoveries a few days later go back to get reinfected, is there a strategy in place to quickly move in, get them and treat them again?
Okay, so absolutely yes. It wasn't only South Korea. There were other countries who also brought out papers about people who have been reinfected. But they weren't certain whether it was actually reinfection or reactivation of the virus, or they were never actually cured. Those things keep remaining. But one day, they came out to say that it was not reinfection. Actually, there was an error in the test they had conducted. It kept that matter to rest. However, with COVID, anything can happen. You can have people who can be reinfected. There are still people talking about it. The good news is the following, that in Ghana, when you are diagnosed, you're just like any other patient. We have all the data about you. You know, when you get to the hospital, you put your number, where you stay, your next of kin. We have all that. 2, when we say you have recovered, that is not the end of the story between you and us. There is a long relationship. And that relationship is that first week, you come for review. Second week, you come for review. And in 1 month time, you come for review. The next good news is that most of our cases, sometimes we look at them, if we are not too satisfied with your recovery status, not with the test, but maybe you've recovered, you have 2 negative, but physically you are not that strong. We do x-rays, chest x-rays, and in some we even do CT scan, right, to make sure that your chest is clean and you're actually going home. So there is that strategy in place that builds that relationship between a doctor and a patient.
Have we had any reinfection in Ghana as we speak?
You know, so far, till date, we've not had a case come back. You see, the protocol is so strict that we are using in Ghana, that you do the first test, do the second test, and then say goodbye. But there is one thing we should understand. We've had cases whereby after the 14 days, you do the first test, it comes negative. You do the second one, it comes positive. We will keep you until we get the 2. So that has dragged us to sometimes even 1 month. But now what is happening here is this. It is too early to be talking of reinfection because we got hit on the 12th of March, right? And today is May 15 or 16. So what is happening is that we are just 2 months, right? And those that we've had who have recovered, which means they are less than 2 months recovered, and those who have given us such issue because of the double testing for the 2 negatives, we've been able to avoid that. But it is possible that such a thing can happen. it's possible. With COVID, as I say, it's a learning process, and we cannot say that it might not happen.
That's Dr. Akoria there, speaking to my colleague Latif Idrisu. So just because you got off with a negative result doesn't mean that you're all immune. You need to be careful and not to be complacent.